Hi, welcome to Freer Dental Aesthetic and Implant Center. Today we're going to show you a case of a patient that come to our office to change an old metal filling using the safe mercury removal technique, which is described by the International Academy of Oral Medicine and Toxicology.
The International Academy of Oral Medicine and Toxicology warns that any number of mercury fillings can be hazardous to a dental patient's health. All dental amalgam restorations, also commonly referred to as silver fillings, contain approximately 50% mercury, and reports and research are consistent that these fillings emit mercury vapors. It is well known that mercury will be deposited before the kidneys, liver, neurological tissue, gastrointestinal tract, and then in the remaining tissues. The symptoms related to mercury amalgam has been discovered long time ago. Mercury vapor is odorless, colorless, tasteless, and toxic, but it casts a shadow in black light. Scientific research demonstrates that dental mercury amalgam exposes dental professionals, dental staff, dental patients, and fetuses to releases of mercury vapor, mercury-containing particulate, and/or other forms of mercury contamination. The IOMT protocol recommendations for amalgam removal are known as the Safe Mercury Amalgam Removal Technique, SMART. These recommendations include the following measures, which are listed here with scientific research. In order to protect the patient's skin and clothing, a full-body, impermeable barrier as well as a full head, face, and neck barrier under and around the dam should be utilized. Protective gowns and covers for the dentist, dental personnel, and the patient should be in place. All present in the room should be protected because substantial quantities of particles generated during the procedure will elude collection by suction devices. Of course, as a protocol, the doctor has to take x-rays for every restoration to check how the old restoration is doing regarding cavities and possible peripheral infections. The patient should be given a slurry of charcoal, chlorella, or similar absorbent substance to rinse and swallow before the procedure. Among all the procedures of routines performed in the dental office, the procedure that is most feared by the patients and also creating anxiety is the injection of anesthetics. That's why here, in Freer Dental, we have the latest technology in computerized assisted anesthesia called the Wand. The advantages this computer system provides to the patient are the absence of pain during administration of local anesthetic, less post-operative discomfort at the injection site, greater depth of anesthesia, increased duration of the anesthesia, the possibility to run simultaneously on more parts of the mouth because the facial mobility is not compromised. A dental dam made with non-latex nitrile material should be placed and properly sealed in the patient's mouth. External air or oxygen delivered via nasal mask for the patient also should be utilized to assure the patient does not inhale any mercury vapor or amalgam particulate during the procedure. A nasal cannula is an acceptable alternative for this purpose as long as the patient's nose is completely covered with a waterproof barrier. Each room where mercury fillings are removed should have adequate filtration in place, which requires a high-volume air filtration system, such as an at-source oral aerosol vacuum capable of removing mercury vapor and amalgam particles generated during the removal of one or more mercury fillings. A saliva ejector should be placed under the dental dam to reduce mercury exposure to the patient. Now we can start removing the old dental metal filling in a safe mercury-free environment. Once the removal process is complete, the patient's mouth should be thoroughly flushed with water and then rinsed with a slurry of charcoal, chlorella, or similar absorbent substance. If you're thinking about changing any old metal restorations in your mouth using the SMART technique, developed by the International Academy of Oral Medicine and Toxicology, here in Frere Dental, we'll be more than glad to help your body be mercury-free.